Hi everyone, I'm Marissa Arief, Stray Animal Care Program Coordinator in Indonesia for 4PAWS. I'm honored to be here today speaking alongside one of our longtime partners, the Bali Animal Welfare Association, or BAWA, represented by Mr. Ade Andreawan, or as we say in Indonesia, Pak Ade. Today we'll share about Program Dewata, bridging animal welfare and public health through a One Health approach to humane rabies control in Bali. BAWA was founded in 2007 by Janice Girardi, who has called Bali home for over 40 years. 4PAWS and BAWA have been working together since 2018. BAWA's mission is to put compassion into action and to create sustainable change so every Bali village becomes a sanctuary for animals. Their work focuses not just on rescue, but on transforming attitudes and behaviors in the community so that cruelty and neglect don't happen in the first place. This philosophy aligns perfectly with 4PAWS's approach to building long-term, community-led solutions in animal welfare. Our partnership began in 2018, followed with the launch of a joint initiative called Program Dharma, which later evolved into Program Dewata, meaning Program of the Gods, a name that honors Bali's cultural identity as the island of the gods. Program Dewata is a comprehensive One Health initiative that addresses the interconnectedness of animal, human, and environmental health. Its mission is to humanely manage the stray dog population and reduce rabies risk in Bali. The program's tagline captures this beautifully: healthy animals, safe families. Our community-based approach includes animal health days tailored to local needs, providing sterilization, vaccination, and basic care. Door-to-door community-based dog population management, mapping dog ownership, vaccination, and health status, even through challenging terrain. Capacity building and engagement with local governments, health centers, and schools to reduce bite incidents and improve safety. Education and awareness campaigns, including efforts to integrate animal welfare into school curricula, because sustainable change starts with informed communities. Multi-stakeholder advocacy, partnering with government, health departments, and community leaders to implement One Health through joint planning, workshops, and ongoing dialogue. Before we dive deeper into Program Dewata, let's take a quick look at its history. It was first launched in 2016 as Program Dharma in Sanur, Bali. In 2019, with support from 4PAWS, BAWA expanded Program Dharma into Karangasem, the poorest regency in Bali. In 2024, Program Dharma was renamed Program Dewata, and we began our work in Batur, located in the highlands of Bangli Regency, known for its active volcano and steep terrain, challenges that make our work even more meaningful. To share more about how Program Dewata works in practice and the tangible results we've achieved, I'm happy to introduce my colleague and friend, Mr. Ade Andreawan from the Bali Animal Welfare Association. Thank you.
Thank you, Ibu Marissa. Hi everyone, I'm Ade Andreawan from Bali Animal Welfare Association in Bali. I will be continuing the presentation with the challenge for our program implementation. The first challenge is lack of veterinary capacity and accessibility. In our program area, the number of vet is very small and most of them focusing on livestock or farm animals. The vet in this area also have limited ability to perform spay and neuter. Other than that, we found the treatment costs for vet service are really expensive, and the situation makes the throwaway culture on sick dog happen more often. People think it will be easier and cheaper to buy a new puppy rather than to spend a lot of money to treat a sick dog. Another challenge we faced was the difficult terrain. The location of our program area surrounded by active volcanoes with extreme terrain, which made the government officer and our team find it difficult to reach some sub-village location when we do mapping, education, vaccination for rabies, and health day. The next challenge we face is the problem of unregistered breeders and sellers. Our program area become overpopulated because uncontrolled breeding and puppy dumping that increase stray dog numbers. Poor health standard and this lack of vaccination and vet care situation cause health risks. As you see in the photos, there's a lot of home breeder in this area. In the mapping, we found around 71 home breeders. This is also related to disease spread. Unregulated movement of animal increases rabies risks because the breeder and seller sell the unvaccinated puppies on the roadside, through online, social media, marketplace, and they send the puppies inter-district, even shipped to another province. The fact is, some of the positive rabies cases that happened in south of Bali area recently comes up from the puppies that people buy from our program area in Batur. For dog meat trade, breeding activities linked to unethical practice and animal abuse. They either dump the unsold puppies or hand them over to the dog meat collectors. This is related to our program area, is part of the main access for dog meat transportation to the northern part of Bali Island. Another challenge is counterproductive regulation that are not in accordance with animal welfare principles. Regulation that include chaining and caging create misperception that lead to animal abuse. We receive many reports every day about chaining and caging issue that carried out by individuals who never release or give their dog or cat opportunity to freely express their natural behavior. In Bali, we have traditional regulation that usually impose high fine so that people become afraid and prefer to throw away or hand over their dog to the dog meat collectors rather than having to pay a high fine because their dogs are roaming around outside their house. Next is misinformation spread by the media has made people panic and fear due to a lack of understanding regarding rabies. For example, there is an article in newspaper in Bali a few weeks ago that mentioned there is 300 people in Bali tested positive rabies in 2024, which is not correct. The challenge in building communication with other stakeholders is also a major challenge in this program. Maintaining the momentum, enthusiasm, dialogues, coordination, and communication need a lot of efforts and also need few different approaches for each stakeholder. Next is our program update and achievement. Our program area is in Batur, Bangli, with total 24 sub-villages called Banjar that surrounded by active volcanoes. We have 10 local facilitators that train for 1 full month about One Health, animal welfare and health, rabies, mapping, and community engagement. Until now, we educated 3,445 households about animal welfare and health, and also rabies. There is 13 government stakeholders such as Agriculture Department, Health Department, Education Department, Tourism and Culture Department, Regional Disaster Management Department, Communication and Information Department, Governance and Partnership Relation Department, Legal Department, Satpol PP or Civil Police, Puskesmas or Community Health Center, Puskeswan is Animal Health Center, Village Government, Bendesa Adat or Traditional Community Leaders, and also Vet Association that coming from provincial and district level actively collaborate in our program. We also do vaccination that reach 76% from population and also sterilization through health day activities. We complete door-to-door mapping in 24 sub-villages with total result of 1,873 dogs and 1,833 households. We also complete 31 coordination meetings, 3 workshops, and World Rabies Day event that invited stakeholders from national, provincial, district, and village level. We do advocacy for regulation on puppy breeding and selling as a part of collaboration among stakeholders. We have done the curriculum development of animal welfare and health, including rabies for primary school. And right now, we are in progress to develop curriculum for junior high school in collaboration with Education Department in Bali. There are 9,755 students from 70 primary schools already received the animal welfare and health lessons. There are no rabies cases in our program area this year. There has been a very significant decrease in dog bite cases at our program location. And this program is recognized by the government as a pilot program that is expected to be developed and replicated in other villages in the future. We would like to express our gratitude to Forpos International for giving us their full support and trust so that we can build an effective collaboration in implementing this program. We hope this collaboration can be sustained and reach more wider beneficiaries in the future. That's all that I can present about our challenge and our program achievement, and I hand it back to Ibu Marissa. Thank you. Matur suksma.
Thank you, Pade, for that great update on our progress. Program Dewata shows that a One Health approach truly makes a difference, not just for animals, but for people and the environment too. Here you see Janice, Bawa's founder, with local students at last year's World Rabies Day event. The students created posters promoting responsible pet ownership, including one saying, "Don't throw away your dogs." Program Dewata is improving lives, empowering communities, and setting a new standard for sustainable, humane solutions. Together with Bawa, we're already seeing results: healthier communities, greater awareness of responsible pet ownership, more compassionate treatments of dogs, and a scalable model that can be replicated across Bali and beyond. As we look ahead, our goals are clear: to expand Program Dewata into more regions across Bali, to strengthen access to veterinary care and increase spay and neuter capacity, to advocate for progressive, enforceable animal welfare policies, and to continue building trust with communities and fostering multi-stakeholder collaboration. If you're interested in implementing One Health initiatives in your community, please feel free to contact us. On behalf of Forpos and our partners at Bawa, thank you for your attention and for joining us in the vision of a kinder, healthier future for all.